Your child has been tested for COVID-19. COVID-19, or novel coronavirus, is a viral infection. Most children will have mild symptoms. The most common symptoms are fever and cough. Less common symptoms include sore throat, runny nose, vomiting, diarrhea, muscle aches, tiredness, skin changes, or shortness of breath. As with most viral infections, you can manage your child's fever and pain with medications such as acetaminophen and ibuprofen, unless a doctor has advised you not to take these. You should encourage your child to stay hydrated by drinking fluids often. If your child's COVID-19 test result is positive, then you will receive a call from the emergency department, as well as from your local public health unit, to discuss the result and the need for ongoing isolation. Please ensure that the emergency department has your correct phone number before you leave today. If your child's COVID-19 result is negative, then you will not receive a phone call notification, but you can look up your child's test result through the SickKids MyChart online portal or the Government of Ontario's online results viewer. Even if the test result is negative, your child should remain in isolation until they are symptom-free for at least 48 hours in order to avoid making other people sick. Isolation for a child means staying home, not going for walks outside and no visitors to your home, avoiding contact with others as much as possible, especially any at-risk people who live in your home, covering their coughs and sneezes, washing their hands frequently. Other people in the same household as your child should self-monitor for symptoms. It can take up to 2 weeks from the time a person is exposed to the virus to the time they start showing symptoms. They should avoid contact with the child by staying in a separate area within the home when possible, using a separate bathroom, and wearing a mask when needing to be in the same room as your child. You should also clean household surfaces often and ensure everyone washes their hands frequently. If you need to return to the emergency department and your child has tested positive, then call ahead at 416-813-5807. When you get to the hospital, let staff know you have arrived and have your child wear a mask. For the most up-to-date information on visitor and caregiver restrictions that are currently in effect at SickKids, please visit the SickKids website. Return to the emergency department if your child has weakness or poor energy despite good fever control, is not waking up or not interacting, is not drinking or has persistent vomiting, has a fast heart rate even when their fever is down, has difficult, fast, or noisy breathing, has blue lips or skin color, or has a seizure or convulsion. If your child has a persistent fever, contact your primary care provider, who may advise you to return to the emergency department for assessment. For more information about COVID-19, including trusted resources to help you talk to your children about COVID-19, parenting resources, and mental health resources for kids during the pandemic, please visit the About Kids Health Learning Hub. Further information can also be found by visiting covid-19.ontario.ca or by calling Telehealth Ontario.